Alright, hello, my name is Chris. I'll be your nurse today. Today what we're going to do is a full head to toe assessment from top to bottom. Before we get started, I've gone over your health assessment already. I've already asked you to empty your bladder. I've asked you to dress in shorts and a tank top for this assessment. I'm going to close the door for privacy purposes, or pull the shade, whichever one you want to do. And then I'm going to wash my hands before we get going. Going over your health history, you appear to be as stated age. Your level of consciousness is awake, alert, and oriented to person, place, and time. Your nutritional status appears to be well nourished. Your speech is coherent with your age range and clear and concise. English is your language or native language. Your gait appears to be proper and good. There's no use of assistive devices. Your position and posture appear to be good as well. I have you sitting straight up, erect, with legs dangling. Your skin is pale pink in color. Your eye contact is good. Your mood and affect seem to be appropriate for the situation. Facial expressions match those mood and affects. So before we get started, I'm going to go over and we're going to kind of go through the skin assessment with each system. So I'll be noting those as we go along. Getting started, we're going to get started with our head. So with our head, it is symmetrical. There is no bumps or abnormalities in the cranium. The scalp is, again, pink, white, pink pale in color. There is no scars, scratches, or cuts, or tattoos. On the scalp, hair is red in color and intact. Soft in feel. Next, we're going to move on to the face. With the face is symmetrical. Again, skin is pale pink in color, little rosacea on the cheeks. Face is symmetrical, however. And when we're going to test for also our cranial nerve 7, which will be our cranial nerve that affects the face. So first thing I need you to do is puff out your cheeks really wide. Okay, next we're going to smile big, lots of teeth. Okay, and the next one is close your eyes really, really tight. And last one will be raise your eyebrows really, really high. Super excited. Okay, thank you. Cranial nerve 7 is intact. Moving on to the eyes. Eyes are symmetrical in size. Both externally, the eyelids are pink pale in color. Eyelashes attached to the eyelids appear to be intact and well groomed. Eyeballs seem to be round and symmetrical in shape. Conjunctiva is light pink leading in, and then the sclera is white. Cornea is bluish gray with but they are symmetrical on both sides. No abnormalities noted. Next, we're going to test for a couple different things. First, we're going to test our pupil reaction. So I'm going to turn the lights off, and we're going to test with the pen light. We're going to test for first the pupil reaction. Starting at pupils are about a 5 to start. What we're testing here is just to make sure that they dilate with the light. Eye open there, please. Thank you. They do drop from about a 5 to about a 2. Which is normal. Next, we're going to test for acclimation. So that means that I want you to follow this pen light. I'm going to bring it in close to you, and your eyes should converge on the center of focus. Thank you. And then they do converge. They do converge normally, so acclimation is normal. Next, we're going to test one last thing. I need you to follow my finger. Okay, what we're going to do is we're going to test for cranial nerves 3, 4, and 6. This is going to test your extraocular muscles and eye movement. So first I'm going to go up. Now just follow with your eyeballs then, please. Cranial nerves 3, 4, and 6 appear to be intact. Your eyes move symmetrically and as they should, following the finger. Next, we're going to assess the ears. Ears appear to be equal in shape, symmetrical. They are both positioned in the same area. There are 2 piercings on the left and 2 on the lower portion of the ear and 1 upper on the right. Your auditory canal is clear, so you should be able to hear somewhat decently. I'm going to palpate a little bit on the side, on the front here, the tergus, and let me know if there's any sort of tenderness as we do that. Okay. So there's no tenderness. Last thing we're going to do is test for cranial nerve number 8. Cranial nerve 8 is going to test your hearing. So I'm going to whisper. I'm going to cover one ear, whisper 3 words into one side. I'm going to do the same thing on the other. So just repeat these words out loud when I say them.
Blue, blue, red, and green. Whiskey, Tango, Foxtrot.
Cranial nerve 8 appears to be intact. You can hear the whisper as we test there. Next, we are going to test for the nose. Nose again appears to be symmetrical. There is, again, skin is pink, pale pink in color. There is no tattoos, lesions, or piercings. What I'm going to do next is actually look inside your nose, make sure that there is nothing inside that's going on. So we're going to look for any bleeding, any drainage, any polyps, and there are none at this time. Last one we're going to look at is for your mouth. Your mouth, lips appear to be pink in color, do not appear chapped. There's one little scar on the right side of the lip, on the right lower lip, a little scab. Looks like from maybe a busted open lip or chapped lips. And then if I could have you open your mouth, I don't say yet.
I'm sorry.
I am going to use, so what I'm looking for, I need to open up. I'm looking for your buccal mucosa, your tongue, your teeth and gums, your palate, your uvula, the base of your mouth, as well. So lift up your tongue. Okay, teeth and gums appear to be intact. Palate and tongue appear to be intact as well. They're all pink and moist as they should be. Next, I'm going to look for your tonsils. We're going to grade your tonsils here.
Really?
Yes.
Do I gotta say ah?
Not yet. Okay. Tonsils appear to be at a 1 plus, which is what we want to see. That's a normal finding.
That's good.
Next, we're going to test for cranial nerve 9. No, not 9. Cranial nerve 9 is the last one. I'm not actually going to do that one because that is going to test your gag reflex. So we are not going to test your gag reflex. I do not have a tongue depressor to test that. And normally what we would do is to test cranial nerve 9 is stick a tongue depressor in the back of your mouth until you gag. So to test for cranial nerve 12, I do need you to, cranial nerve 10, I'm going to have you open your mouth, and I need you to say ah.
Ah.
Okay. Uvula is in the midline. Cranial nerve 10 is intact due to that. Next thing I need you to do is this is testing cranial nerve number 12. Cranial nerve 12 is going to test is going to look at your tongue. So what I need you to do is stick out your tongue. Ah. Okay. Cranial nerve 12 is in the midline. Your tongue is in the midline when you stick it out, I should say. Cranial nerve 12 is intact.
Okay.
Next, we're going to move on to the neck. So we're going to palpate for your. So first, there are no lesions or bruises or tattoos or markings of any kind on the neck at this time. So what I'm going to palpate for are your lymph nodes. So we're going to start with the pre-auricular, which is kind of right here in front, post-auricular, your occipital, your the submandibular, the jugulogastric, the supraclavicular or cervical, the deep cervical chain, the post cervical, and the supraclavicular. Okay, I'm also going to again assess to make sure that the trachea is in the midline, which it appears to be. Trachea is in the midline, and then I'm going to assess for your carotid artery. So we're going to double check and make sure in here. So this will, okay. Good on the right side. And once again, I'm sorry, good on the left side, and again, good on the right side. Next, I'm going to actually listen to your carotid artery. So when I actually place the bell on you, what I need you to do is actually when I place the stethoscope on, I do need you to hold your breath for just 1 second so I can hear. Okay. Same thing on the other side. Hold your breath. Okay. I do hear no roots in your carotid artery, so that is again we can hear the pumping of the heart through the carotid artery, which is what we want to hear. Next, I'm going to actually come around behind you. What we're going to test for here is actually your thyroid gland. So what I need you to do is actually kind of lean your head forward a little bit, not too much, a little bit, just a little bit, and then turn it to the right side. Okay, and then swallow for me. And one more time. Okay, I cannot palpate the thyroid or the thyroid gland at this time. So we are going to move on to your upper extremities. Upper extremities appear symmetric. There again, the skin is warm to the touch, pale pink in color. There is tattoo on the upper left shoulder. Arms appear again to be intact. Looking at the nail beds, they are pink and translucent. Capillary refill is less than 2 seconds. So that's again what we want to see. Hands are warm. One thing we're going to do here, this is going to test your kind of symmetry of your strength. So I need you to squeeze my fingers as tight as you can with both hands as I say the
Same time?
Same time.
Okay.
Go. Okay. Strength is symmetrical on both sides. Last thing we're going to do is actually test for cranial nerve 12. It's cranial nerve. Is it 12? All right. Yes, I believe it is. Cranial nerve. I'm sorry, no. This is cranial nerve 9. Cranial nerve 9 is going to test for your strength. So what I need you to do as I put a little resistance on your shoulders is shrug your shoulders upward.
Okay.
Okay, go ahead. As hard as you can. Thank you. Okay, the cranial nerve 9 is intact, as the shoulder shrug test is well. So I'm going to step again back behind you. I'm going to raise your Sure. Up again. We're gonna look at
Okay.
the back. Skin again is pale pink. I'm going to assess for your lung expansion. So I'm going to kind of pinch and hold about your T9 and T10 as you breathe. So take a decent breath in. You do have equal lung expansion on both sides. Back is symmetrical. I'm just going to put this up here. I'll keep your arms down though.
Oh,
so you-
sorry.
Again, no bumps or bruises. There is a small mole in the back, like upper mid, but it does not appear to be abnormal at this time. Next, I'm going to listen for breath sounds. So there's 18 spots I'm going to listen to. So I'm going to kind of go across as I go up and down. Just keep breathing normal. No crazy breaths. If you
Okay.
do start to feel lightheaded, please let me know though.
Okay.
All right, there are no advantageous sounds in that I heard in your lungs, which is again something we like to see. If there were advantageous sounds, what I would do is there's 3 tests we would do. One is a bronchophony, and then an egophony, and then a whispered tranquility. I think I said that right. One more thing I'm going to do, go back real quick to the arm. I'm going to actually hold, I'm going to actually palpate your axillary nodes just to ensure that we do not see or feel anything abnormal in there. Do not feel anything abnormal in the axillary nodes. I know when I'm a lot of out of sequence there. I do apologize for that.
Okay.
Next, we're actually going to look at the front. That's why we have you in a sports bra.
Okay.
We're going to check the front midline. Okay, so again, your thoracic cage seems to be intact. Breasts are symmetrical. Left is a little larger than the right, as they should be. I'm going to test for skin trigger. So I'm going to go right just below your clavicle here and pinch in. Again, you have no skin trigger. Skin goes back very quickly, which means that the elasticity in your skin is doing well. Nipples are in the midline, which is where we want to see them at this time. Next, we're going to actually move to the bed. Yes. So maybe lay at about a 45-degree angle. I'm going to step to the right side of you. I need to turn this.
Says 45.
Just about. Okay. So what we're going to do is I'm going to try and palpate for your apical pulse. So I'm going to count down and try and find the 5th intercostal space. Right about here. I can slightly palpate the apical pulse, but next I'm actually going to auscultate for it. and actually count your pulses. The apical pulse is at about an 80, which is pretty normal. Again, I went a little out of order here, so what I'm going to do is actually have you turn your head to the left. I'm going to look for venous vein distension, which I do not see. Okay, I'm going to turn your head back. I'm actually going to move that, so you can go down to about a 25. That's when I would actually do that check for your apical pulse. Next, I'm going to acetate first with the diaphragm, then with the bell in your 5 different regions of the heart. So we're going to look for the aortic valve, the tricuspid valve, Erb's point, the tricuspid, and the mitral valve. The pulmonic and the mitral valve. So it's, again, we're going to listen first. Now I'm going to go do the same thing with the bell. And what I'm listening for here are murmurs, and also your S1 and S2. So again, there are no murmurs. If I did hear murmurs, I would actually roll you to your left side, so I could move the heart a little closer to your thoracic cage, so that I could assess for any further murmurs. If there were further murmurs at that point, I would actually have you sit up and lean forward, so I could listen with the bell even closer. Okay, so there are S1 and S2. Next, we're going to assess the abdomen. Okay, abdomen again is pale pink in color. It appears to be symmetrical in shape. Does not appear to be any contours at any point or anything like that. I am going to acetate for bowel sounds in your lower right quadrant. Which I do here, so I do not need to continue. So now what I'm going to do is actually start with light palpations and then deep palpations in your lower right quadrant. Feeling for any abnormalities or anything like that. Again, there's no... I'm going to come back around and actually do a little deeper palpation. Let me know if there's any tenderness. Next, I'm going to actually try and palpate the spleen. I should not be able to feel this, but I'm going to go right underneath here and actually try and palpate. I cannot palpate the spleen. Do not feel it, which is, again, it's normal. We would normally palpate the spleen if it's three times the size at that point. Next, I'm going to actually go to the fifth intercostal space, and I'm going to actually percuss. For the liver. So what I'm doing here is actually percussing for the liver. You are at about almost 7 inches, which is normal for a female. Normally their liver span is about 7 inches at that point. And that's for that. Next, we're going to go to the lower limbs. Again, lower limbs are symmetric. They are warm to the touch. Does not appear to be any edema. And I'm going to test to see if we can feel the dorsal pedialis, which we can. It's about a +2, which is, again, that's good. That means that we can feel a pulse in your foot at that point. One thing I'm going to do next is actually test for Babinski. Okay, you are negative for Babinski. Means that your toes curl when I do give you a little rub. So we're going to test for a little bit of strength. So go ahead and pull your toes up, okay, and push down. Okay, those are normal. Range of motion, we're going to check for full range of motion. So we should be able to go up and down, and up, and out, and down. Same thing on the other side. Up, down, up, up, down. Range of motion is normal. Again, legs are symmetrical. So now I need you to scoot to the edge of the bed. And I'm going to test for, so leave your feet dangling. I'm going to test for your patellar reflex. Go ahead and relax your arms, kind of lift them up a little bit actually. Okay. Patellar reflex is normal. There is a little bit of a jump when hit. One last thing we're going to do is actually have you stand up. We're going to do the Romberg test. The Romberg test, I'm going to stay next to you, stay kind of in front of you here. What I need you to do is stand with your legs together, okay, upright position, and close your eyes for about 20 seconds. This is testing for your balance, your equilibrium. Okay, thank you. You are negative for the Romberg test. You can grab a seat again. That concludes our head to toe assessment. Do you have any questions about what we did today?
No.
Thank you very much. I'm going to wash my hands one more time as we finish up. Thank you very much.